Today we are going to talk about white blood cells, leukocytes, right? White blood cells which are present in the blood, they are basically divided into five categories. White blood cells, but primarily they are divided into two categories. Yeah, what are the two basic categories of white blood cells? Granulocytes and non-granulocytes or agranulocytes. Granulocytes and non-granulocytes or agranulocytes. Non-granulocytes. Now, do you think non-granulocytes don't have granules, or do they have granules? They have granules, but they are non-specific granules. Actually, those white blood cells which have specific granules, they are called granulocyte, and those white blood cells which do not have specific granules, they are called non-granulocytes. Non-granulocytes are further divided into three types of cells. And non-granulocytes, they are divided into two types of cells. Right. Now, granulocytes, they are neutrophils, there are eosinophils, and there are basophils. And non-granulocytes or agranulocytes, they are monocytes, and there are, yes, lymphocytes. Right? Now, granulocyte. How do you differentiate neutrophils from other? Neutrophils have nucleus which is multi-lobed, right? 2 to 4 lobes of nucleus, multi-lobated nucleus. Neutrophils characteristically have. And with that, it has granules, some granules which are staining eosinophilic, they take the acidic dyes, and there are some granules which take the basic dyes. Neutrophils. But when we talk about, these are neutrophils. And because neutrophils have different morphologies of nuclear material in different cells, because in some neutrophil you have 2 lobes, in some neutrophil you have 3 lobes, and some neutrophil nucleus has 4 lobes. So we also call polymorphonuclear neutrophils. Morphology means structure, polymorphonuclear neutrophils, or simply some people call them polymorphs. Polymorphs, right? Poly mean many, morpho mean structure. The many different structures of neutrophils, nucleus seen in different neutrophils, right? Then there is eosinophil. Eosinophil is a cell as if he is having, what is this? I always feel somehow they are having the glasses. Bilobed nucleus. Classically, eosinophils have bilobed nucleus, and eosinophils have the granules, specific granules, which are stained by eosinophilic dyes or acidic dyes. Right? The granules, they are specific granules, take which dye? Acidic dyes, eosinophils. Red color lovers. Eosino mean basic dyes, or eosino mean red, pink. Eosinophils, phils mean loving. Eosinophils, cells which love the red color because the granules take red color. Then there are basophils. Their nucleus is also somewhat bilobed, right? Nuclear material. But the granules are staining, yes, blue. Blue for basophils for basic dyes. Basic dye, blue dyes, right? So these have blue granules. The specific granules take the blue stain easily, or basic dyes easily, right? Then we have non-granulocytes or agranulocytes. Agranulocytes, classically you must know first of all, what is this? Monocyte. Monocytes have granules, but these granules are non-specific granules, like lysosomes. Right? Then there are lymphocytes, and lymphocytes have a very large nucleus and very little cytoplasm. This is a very specific way to recognize the lymphocytes. Actually, as a good doctor, you must be able to recognize these cells just by their simple structure. If you see in any inflammatory tissue, inflamed tissue, white cells with multiple lobes, they must be neutrophils. If you see white blood cell with bilobed, most probably eosinophils, especially when they are staining with the red color or eosinophilic dye, right? And bilobed nucleus with blue staining dye, you can say granules, this is basophils, right? And then kidney-shaped cells, kidney-shaped nucleus with the white cells, and these cells are having non-specific granules, these are monocytes. And lymphocytes are very peculiar that they have a very large nucleus and very little cytoplasm. Is that right? Now, when you compare these cells, eosinophils, and then there are, yes, let me write their names, basophils, and then there are monocytes, and there are lymphocytes, right? Now, let's talk about, there is a concept, we use a term called TLC, total leukocyte count, and then there is another term which is used commonly, DLC, differential leukocyte count. Total leukocyte count means that in 1 ml of the blood or 1 cubic millimeter of the blood, what are the total number of white cells, right? If we take 1 drop of blood, and drop of blood is just 1 cubic millimeter or 1 ml blood. If you take 1 ml blood, how many white cells are present in a normal person's 1 ml of the blood? Yes, that is total leukocyte count. So what is it normally? It is somewhere between 4,000 to 11,000, right? 11,000 white blood cells per cubic millimeter. Am I clear to everyone? Right? That if you take a healthy person's 1 drop of blood, which is about 1 ml drop of blood, then white blood cell count should be somewhere between 4,000 to 11,000. And it's important to remember, if in 1 ml of the blood, if white blood cell count is less than 4,000, this is pathological, or if it is more than 11,000, that is also pathological. When it is less than 4,000, we call the condition leukopenia. Penia means less, leuco means white cells are less than normal. And when white blood cells per ml of the blood are more than 11,000, we call it, yes, leukocytosis. They are called leukocytosis. Is that right? So this was something about TLC, that in 1 drop of blood or 1 ml of the blood, how many total white blood cells should be there. But when we talk about DLC, DLC is differential leukocyte count, then you are talking about that out of 100 white cells, what is the percentage of the neutrophils, what is the percentage of eosinophils, and so forth, right? The most abundant white cells are neutrophils. Most abundant white cells are neutrophils. So when we talk about DLC, differential leukocyte count, then neutrophil percentage in a normal person is somewhere between 40 to 75%. In a normal person blood, neutrophil count should not be less than 40% and not more than 75%. This is percentage. Is that right? Now, if your neutrophil count is less than 40%, we call it neutropenia. What we call it? Neutropenia. If neutrophil count is less than 40%, we call it neutropenia. neutropenia. And if white blood neutrophil count is more than 75%, what we call it, this condition, if it is more than 75%, yeah, what you call it? Neutrophilia. Body is in love with neutrophil, then increasing their number, neutrophilia. This type of situation is seen especially in acute inflammation. Neutrophils, as I will mention later, they are also called the cells of acute inflammation. Acute means recent onset inflammation of short duration, right? In short duration inflammation, neutrophils become very active, and in the blood also neutrophil count goes up. Is that right? Because many neutrophils are released from bone marrow stores, right? Then eosinophils. The classical example causes of neutrophilia is, who will tell me? Pyogenic infection, infections which produce pus, like staphylococcal infections, streptococcal infections, pus producing organism produce neutrophilia, right? Then there are eosinophils, and eosinophils normal count is somewhere between 1 to 6%. Eosinophils, they are less abundant. And if number of eosinophil is more than 6%, right, then we say there is eosinophilia. There is eosinophilia. Classically, eosinophilia is seen in your blood when there are parasitic infections or allergic situations. In allergy and in parasitic infections, eosinophils become more in the blood, and we say more than 6%, and we say that patient is having eosinophilia, right? Then basophils. Basophils are the least abundant cell in the blood. Sometimes even out of 100 cells, you don't find there is any basophil, right? So we say they are usually 0 to 2% in the blood. But if basophils are more than 2% in the blood, the condition is called basophilia. Then condition is called basophilia. Basophilia is seen especially in allergic reactions, especially type 1 hypersensitivity reactions. Basophilia, allergic reaction, right? Immediate type of hypersensitivity or allergy. Then we come to monocytes. Monocytes normal percentage should be somewhere between 2 to 10% in the blood out of white cells. Is that right? If you have 100 white cells, the most abundant should be neutrophils. Is that right? And monocytes should be somewhere between 2 to 10%. If they are more than 10%, the condition should be called, yes, here not philia, monocytosis. Monocytosis. Medical science, like life, is not so easy, right? Monocytosis. If someone has, for example, 20% monocyte in the white blood cell percentage, so we call it monocytosis. Monocytosis is classically seen in chronic infections. In chronic infection, long-term infections, monocytosis. For example, person who is suffering with tuberculosis, he will have in the blood monocytosis. But someone who has sore throat due to staphylococcus, he will have neutrophilia. Someone who has allergy, right, he may have eosinophilia as well as basophilia. Someone who has parasitic infection, and in her blood or his blood, eosinophils will be high. Is that right? Then we come to lymphocytosis. Lymphocytosis are said to be there. Normally, what is the percentage of lymphocytes? Lymphocytes are should be normally present 15 to 40% in the blood. But when their count of the lymphocytes become more than 40%, the condition is called, if it is more than 40%, it is called lymphocytosis. Lymphocytosis is classically seen in viral infections. Yes, in viral infections and also in chronic infections. Chronic infections. If there is viral infection, regardless, viral infection is acute or chronic, you will develop lymphocytosis, right? Or in chronic infection. Now it's so easy. If I asked you that someone has acute infection by an organism which is producing pus, which cells in the blood will be more? Neutrophilia will be there, right? But if I say someone has chronic inflammation in the body, which cells will be high? Monocytosis and lymphocytosis will be seen. If I say someone has acute viral infection, classically lymphocytosis there. If I say someone has allergic reaction, especially type 1 hypersensitivity, basophilia and eosinophilia. And if someone has parasitic infections, eosinophilia. So you understand why it's so important to learn, because they point towards the causes of disturbance in the body. In different type of pathological conditions, different type of white cells may be increased in the blood. Is that clear? Now, before we really go into detail, I would like to discuss that from where these cells come. Especially first we'll talk about from where the granulocytes come. All of you know the granulocytes, like other blood cells, are produced in the bone marrow, right? And the process by which the granulocytes are produced in the bone marrow, that process is called granulopoiesis. Granulopoiesis. So now we will talk about granulopoiesis. Granulocytes are produced, of course, in the bone marrow. Red bone marrow or yellow bone marrow? Yellow bone marrow is inactive. So all the granulopoiesis or leukopoiesis or erythropoiesis, they must be going on in red bone marrow. Because that bone marrow which is actively producing blood cells, that is called red bone marrow. So we say hemopoiesis is a feature of red bone marrow, right? And in a newborn, which bones are having red bone marrows? In a newborn, which bones have red bone marrow? All bones. In the newborn, all bones are having red bone marrow. As your age increases, red bone marrow shrink from the periphery and settles into remains in the central area. In my age, I think red bone marrow must be in the axial skeleton, in the skull. I mean, not within the skull. There is brain, I hope. Yeah, this is very important. Later on you say Dr. Najib is having red bone marrow in his skull, right? So actually in skull bones, I must say, there is red bone marrow. There should be, I hope. And in the vertebra and in the ribs and in the pelvic bones and ends of the long bones and short bones of the hands and feet, they should have red bone marrow, right? But in a newborn, all the bone marrow is red. And in my age, after 18, of course I'm more than 18, I should reveal my age, it's more than 18. So after around 18, then bone marrow remains red only in the axial skeleton, and peripheral skeleton become yellow bone marrow. Is that right? Now, let's see that how granulopoiesis occur, right? Let's make a bone marrow house here. This is bone marrow house. Now, in this bone marrow house, we'll see how the granulopoiesis occur. You know, all the blood cells, they are derived from a common stem cell, and that common stem cell is called pluripotent stem cell. Is that right? And pluripotent stem cell initially divides into two types of cells. Yes? Lymphoid stem cell. What is it? Lymphoid stem cell, and there is myeloid stem cell, which is also called colony forming unit, GEMM. Granulocytes, erythroid, megakaryoid, monocytes. Is that right? Because it does not make lymphocytes. Lymphocytes are there. Then this will divide, and this will make what type of cells? Yes, granulocyte and erythroids. Okay. What is there? Granulocyte and erythroid and megakaryoid series become separate. Erythroid and megakaryoid, which will eventually go in the formation of RBCs, right? Through multiple steps, and formation of, yes, platelets, right? And then there is other precursor cells, which will go formation of granulocytes and monocytes. And this cell, which is going to make granulocytes and monocyte, we call it colony forming unit, granulocyte, monocyte. And this granulocyte monocyte will further divide into two, that is colony forming unit granulocyte and colony forming unit, yes, monocyte. All granulocytes are produced from this cell, neutrophil, eosinophils and basophils, monocytes from here and lymphocytes from this series.
What's EM again?
That is erythroid megakaryoid line. Erythroid for the red blood cells, megakaryoid line for the platelets, megakaryocytosis, megakaryopoiesis. Is that right? Any question up to here, or it's difficult? That pluripotent stem cell divided into lymphoid and myeloid stem cell. Myeloid stem cell is going to make all the cells except lymphocytes. Then of course, the cells which are going to make RBCs and platelets, their line becomes separate, and we are left with the colony forming unit which is going to make granulocyte and monocyte. Then monocyte line becomes separate, we are left with the line which is going to produce granulocytes. And this granulocyte line, right, it will divide into two types of series. Rather, now it will divide into three types of series. There is a series which will end up into what? Neutrophils. This series will end up into neutrophils. This series may end up into eosinophils, and the third one series may end up into basophils, right? And here is basophil. So you can say this cell is precursor for basophil, this cell is going to be precursor for eosinophil, and this cell is going to be precursor for neutrophil. We will go into detail of only this, and similar stages are seen here also, right? Now, there are six morphologically recognized stages. 1, 2, 3, 4, 5, and 6 is a mature neutrophil. Now we'll see how this series is going on, what are the changes going on there. The first cell in this series, it is very rapidly multiplying. Because it is very rapidly multiplying, we call it myeloblast. What is this cell called? Myeloblast. So myeloblast cells are rapidly multiplicating cells or proliferating cells, and they have a large nucleus, and this nucleus has mostly euchromatin. Euchromatin means loose chromatin. Remember, when chromatin is condensed, that is called heterochromatin. When any cell, when it is rapidly multiplying, it opens up its DNA and opens up its chromatin because it is replicating its DNA, right? So the cells which are having undergoing very rapid proliferation of mitosis, these cells are rapidly, you can say, duplicating or replicating their DNA. So they open up their DNA, and their chromatin is in which form? Euchromatin, right? And cells which are resting, usually they condense their chromatin, and that is called heterochromatin. So this nucleus has euchromatin, and with that it has some basophilic cytoplasm, myeloblast, right? After that, next stage after the myeloblast is a very important stage which is called promyelocyte. Promyelocyte. In promyelocyte means just before the myelocyte. Is that right? In this case, okay, I didn't tell you, in myeloblast there are multiple nucleoli also, right? In this case, even though nucleus remains somewhat open, I mean euchromatin is still there, nucleoli number become less, right? The very special thing at this stage is that no lysosomes appear, or non-specific granules appear. Which granules appear? Non-specific granules appear. I will make non-specific granules here with black color. These are the non-specific granules. So these are first to appear. Now here I'm going to make this cell, and these are the non-specific granules. Actually, because students get, I don't know why so much confused about these granules, because these are named in many ways. The same granule has, unfortunately, very unfortunately, 4 names. So different books and different MCQs may have, unfortunately, different name but referring to the same granule. These are non-specific granules, right? Non-specific granules, right? There is another name. The second name is, yes, anyone who will tell me the second name? They are also called primary granules. Very good. Primary granules. Third name for the same, so that next time you never get confused. That if someone says that neutrophil has or promyelocyte has non-specific granules, the primary granules, these are the same granules. Any other name? Other name is eosinophilic granules. Have you heard of them? Eosinophilic granule. And last name, of course, which should be the first one, are lysosomes. Have you heard of lysosomes? So lysosomes in the white blood cells, right, granulocytes, are non-specific granules. Why they are called non-specific? Because lysosomes appear in all granulocytes, rather all white cells. Lysosomes are present in neutrophils, they are present in eosinophils, they are present in basophils. Even lysosomes are present in big number in monocytes and their macrophage derivatives. All lysosomes are present even in some of the lymphocytes like natural killer cells. So lysosomes are the granules which are non-specific, and because they appear first of all, they are called primary granules. So next time when you hear this term, the primary granule, the eosinophilic granule, the non-specific granule, the lysosome, they are one and the same thing, right? And they are very rich in special enzymes called acid hydrolases, right? Anyway, then promyelocyte has basically, you can say, primary granules. Promyelocyte have what? Primary granule. Why don't you just write P? Here P is standing for what?
Primary.
Here it is for primary granules. Is that right? Then what happens? That cell will go to the next stage. In the next stage, it will now start making specific granules, right, which are specific for the neutrophils, right? So the next stage is called myelocyte. And myelocyte has more, now nucleus start getting condensed. Some, you can say, heterochromatin appear and nucleoli become very less, right? And already they were, what was these granules? Primary granules or eosinophilic granules or lysosomes or? Yeah. And with that, additional appearance here is which granules? Specific granules. These are specific granules. Now here I would love to mention one thing. Actually at this stage, that is myelocyte stage, neutrophilic, there may be neutrophil monocyte stage, neutrophilic myelocyte stage, or there may be eosinophilic myelocyte stage, or there may be basophilic myelocyte stage, right? These start making specific granules. So here you can do, you can recognize that a particular cell is going to neutrophil series, or it is going to eosinophilic series, or it is going to which series? Basophilic. But as now further development will progress, specific granules, or they are also called secondary granules. There are two names for them: specific granules, and second name is secondary granules. So specific granules or secondary granules keep on progressively increasing. But after this stage, especially after promyelocyte, primary granules are not further made. But because cell keep on multiplying and dividing, so primary granules are maximum seen in promyelocyte, and after that cell do not develop any more primary granules, but because cell divide, so per cell number of primary granulocyte become less. It's very important. Along this all granulopoiesis, the primary granules are seen maximum in which cell? Promyelocyte. Once they go into myelocyte, right, one promyelocyte may divide into many myelocyte, right? primary granule will divide into all the descendant cells, the progeny derivative cells, but every cell will start making also specific granules. After the myelocyte stage, cells lose the capacity to multiply. They simply mature. Up to now, this all development was in which there was mitosis was going on. For example, one myeloblast may convert into many promyelocyte. And one promyelocyte may convert into many myelocytes. But after that, this cell is metamyelocyte. Metamyelocyte, if you have 100 metamyelocyte, they will convert into next 100 cell. One metamyelocyte will go to only one mature cell in next series. Is that right? It means up to this stage, this was which stage of development? Mitotic stage. Mitosis was present. Is that right? And after this stage, mitosis is no more there. No proliferation. Last three morphological forms, right? So what is this form? This form in which nucleus becomes somewhat indented, and it now is going to heterochromatin. And in next form, nucleus becomes exactly horseshoe shaped. And after that, segmentation of the nucleus appear. Of course, these forms have primary granules as well as specific granules or secondary granules. Is that right? And this stage is called, yes, who will tell me? There's myeloblast is the first one, then promyelocyte, then there is myelocyte. Remember, first three stages can multiply. After that, there's simple maturation. And specific, non-specific granule appear in promyelocyte, and specific granule appear in myelocyte. And then here it is what? Metamyelocyte. Metamyelocyte. And then these are called stab cells. These are called stab cells, or they are called band cells. Band cells or stab cells. And then these are the neutrophils. Right? So let's come to the very basic. Now, what is the process of granulopoiesis? Primarily, if you are going to make granulopoiesis, right, you have to start with the very, very early cells, pluripotent stem cell, which should convert into myeloid stem cell. There are special cytokines which work over this stage, right? They derive the pluripotent stem cell into myeloid stem cell. Then myeloid stem cell will be driven into colony forming unit, granulocyte monocyte, especially interleukin 3 work here as the cytokine, right? Then, and plus another cytokine which work here is colony stimulating factor GM, granulocyte monocyte, which will convert myeloid stem cell into this series. Then further into this series, which will convert the colony forming unit granulocyte monocyte into colony forming unit of granulocyte, the colony forming unit granulocyte is there. These are cytokines which work at different stages and control the process of formation of granulocytes. Is that right? Why it is so important to know that? Because these days scientists has made these by genetic engineering, right? And now these products are available in the market, especially colony forming unit granulocyte. And the people who have bone marrow failure, they have very less granulocyte in their blood. We give them injection of these substances so that granulopoiesis can be stimulated and they develop more neutrophils and fight their infections well. Am I clear? Right? Anyway, so first 4 stages. What is this? Pluripotent stem cell going into myeloid stem cell, which goes eventually into colony forming unit GM, and then colony forming unit granulocyte. After that, the different morphological features, the cells are committed to granulopoiesis, right? We have to go by myeloblast, which are proliferative stage, promyelocyte and myelocyte. First 3 are proliferative stage, and they take about 1 week of development in bone marrow. It takes about 7 days to shift from this point up to this point. And then from this point up to the mature, it also takes further 1 week. So it means granulopoiesis takes about, if you give a, suppose, injection of a substance which can stimulate the granulopoiesis, it will take about 1 to 2 weeks to have lot of neutrophils in the blood. Is that right? Why I said 1 to 2 weeks? Because some, before the injection, some are present here, so they will rapidly convert into mature. But most of them will be driven from the early stages. Is that right? Again, what is the feature of myeloblast? Rapid proliferation, but no granules. Promyelocyte develop which type of granules? Primary granules. Myelocytes start developing secondary or specific granules. Metamyelocytes do not proliferate an indented nucleus. Stab cells or band cells are having horseshoe-shaped nucleus. Right? Neutrophils are multilobated nucleus. Is that right? Now, how you can remember all these 6 stages? You remember my sexy friend who makes sexy statements? If you have any statement, you tell him. Otherwise, he told me one statement to remember this. Do you have any way to remember these 6 stages easily? First of all, he say because these are 6 stages, but I don't know why. He doesn't call it 6 stages. He thinks it is 6 stages. It is of course not true. Right? So sex for sex. So there are 6 morphological forms during the granulopoiesis, including the last mature form. Right? Then how to remember it? Right. According to him, not me, blast, he says, I blast. Okay, I don't know what he's going to do. He says, I blast, oh my God, prostitutes. I don't know, he keeps on telling all the secrets everywhere. I blast prostitutes with my what is this? Metallic stabs. I think he will end up with the police somewhere if he keep on telling these statements everywhere. Metallic stabs. And then he says he looks very neutral after that, as he has not done anything. It's very bad, isn't it? In the end, and he himself looks neutral after that. Right? So how, this is his very special help to me, that how to remember these 6 stages, according to him, the sex stages. Right? That blast the prostitute with my metallic stabs and then feel neutral. Not a very good statement, on moral values at least, but it helps you to remember that. If you have some better statement, you can email me, right? Okay, but I don't want many sexy friends. Alright? So this was about another thing. Before I really close this area, of course this neutrophil will come into circulation, isn't it? I show circulation here. Now, in the circulation, what is the life of the neutrophils and how long they last? Normally neutrophils circulate only for few hours in circulation. Normally neutrophils circulate only for few hours. Right? Some of them are circulating, some of them are loosely attached with the endothelial cells. This is called, the cells which are circulating, these are called circulating pool. What is it called? Circulating pool of neutrophils. And some neutrophils which are loosely attached with endothelial cells, these are called marginated pool. Marginated pool. The neutrophils are present in circulation but truly not circulating, loosely attached with the endothelial cells. In the small vessels, they are called marginated pool. So we can say neutrophils have 2 types of pools present in vascular system, truly circulating pools in the vascular system, and with the small vessels with the endothelium, some neutrophils are loosely attached, which is called marginated pools. And remember that 5 times than all these neutrophils in circulation, 5 times more neutrophils are present in the bone marrow in a very near to mature stage. Is that right? And that store of neutrophils which are at these stages and very abundantly present in the bone marrow, that is called bone marrow pool. What is that called? Bone marrow pool of neutrophils. You may be thinking why I am telling you. The reason being that when you develop acute inflammation, lot of cells from bone marrow pool jump into circulation and even marginated pool also come into circulation, so that all of them can go to area of inflammation and fight over there with the infection, right? That is why during acute inflammation in your blood, neutrophil count goes up. Is that right? Of course. Why it goes up? One reason is that granulopoiesis is accelerated during acute inflammations. Second is the bone marrow pool jumps into blood, right? Thirdly, the marginated pool also come into circulating level. So when you catch the blood of the patient into a sample, right, neutrophil count will go up. Is that right? Secondly, a neutrophil remain in circulation for few hours. Some people believe 8 to 12 hours. And after that, they go into tissues. And when neutrophils come into tissues, right, they survive there only for 1 to 2 days. And eventually, they undergo apoptosis. Apoptosis is programmed cell death. Is that right? And when neutrophil go apoptosis, the breakdown products are taken up by the macrophages, phagocytosed by the macrophages. Am I clear? Plus, many of the neutrophils also through the mucosal lining of GIT, they jump into GIT lumen and eventually appear into fecal matter. A significant portion of your fecal matter is basically neutrophils. Is that clear? So where the you know now neutrophils from where they come? They come in from bone marrow. They circulate for a few hours, then they go into tissue. There they live only for 1 to 2 days, and many of them in the tissues undergo apoptosis, and they are taken up by macrophages, right? Many of them are destroyed in spleen, where macrophages are very eager to eat the cells, right? And many of these neutrophils also jump into from the mucosa of the GIT into the lumen of the GIT, and they're lost in fecal matter. Is that right? So let's have a break now.